Welcome. On behalf of the National Transit Institute, I thank you for participating in the TCRP Report 164, Community Tools to Improve Transportation Options for Veterans, Military Service Members, and Their Families webinar. The National Transit Institute develops, promotes, and delivers training and educational programs for the public transit industry in the United States. We are pleased to have Buffy Ellis and Heather Menninger as our presenters. Buffy Ellis, who is with the KFH Group in Bethesda, Maryland, is a specialist in paratransit and transit planning and system design, needs assessment, and performance evaluation. Beginning her career in 1978, she has managed numerous consulting projects for public and private agencies. She is a member and past chair of the Transportation Research Board's Committee on Paratransit and a member of the TRB Committee on Transit Capacity and Quality of Service. Heather Menninger is principal of AMMA Transit Planning based in Riverside, California. Her expertise, developed over more than 25 years of consulting, lies in identifying and implementing improvements to community-level transit services, with particular emphasis on small urban and rural settings. Also a member of TRB's Paratransit Committee, she has published various papers, including 2 in the Transportation Research Record regarding paratransit demand estimation and 1 forthcoming documenting the cost savings of travel training.
What we'd like to do this afternoon is introduce the guidebook, including what's behind it in terms of the research that we did, then discuss the unique mobility challenges that are faced by veterans, then talk about measuring the performance of initiatives and improvements that are made to expand mobility options for the target groups. So what I'll do is I'll introduce the guidebook, then Heather, who is my co-author, will talk about the next 2 topics. So in terms of the guidebook, it does result from about 10 months of research that we did in 2012, and from that we developed the report. So I'll give a very brief background of why the research project was initiated, outline briefly the research that we did, present some of the key findings that provide the context for the report, and then give you just a quick preview of the report itself. Before I started, I wanted to just particularly recognize our project panel for this project. We were very fortunate to have a panel that was very engaged and very helpful in shaping the research and the final report. So in terms of the project background, by 2005-2006, there was a growing understanding in our country about the types of issues that veterans of Afghanistan and Iraq were facing once they left the service and began to integrate back into their civilian lives, and this included issues of transportation. Many of the young veterans were coming home with serious injuries, with PTSD, and then many had trouble finding employment. And particularly for veterans that were returning to small and rural communities, transportation was often a problem. There were a number of efforts made to address the transportation needs of the veterans, and these include efforts by the VA, which in 2010 began the Veterans Transportation Service, or VTS, with pilot projects at 4 different VA medical centers. The objective here was specifically to improve access to VA medical services for veterans with disabilities and those living in rural areas. Since 2010, the projects have moved beyond their pilot status, and there are VTS programs at more than 40 different VA medical centers around the country. And apparently the VA plans to have a VTS program at all its medical centers. So another effort was the Veterans Transportation and Community Living Initiative, or VTCLI. That began in 2011 when the FTA, partnering with the VA and Departments of Labor, Defense, and Health and Human Services, introduced this initiative. And what they did was provide 2 rounds of grant awards for technology projects to build what's called one-call, one-click centers. And the intent there was to improve information and access to transportation services for veterans, service members, and then others in the community that have transportation needs. And it was also about that same time TCRP produced research results in '99 addressing transportation for veterans. And one of the specific findings of that research was that a, quote, how-to toolkit was needed that would help communities implement transportation improvements for veterans. So that basically was the genesis of our project, TCRP B42, which became this report. I note here that our project panel expanded the focus beyond just veterans to also include military service members and their families, Not surprisingly, that in turn expanded our scope because the transportation issues of service members and families are different from veterans. So the project had two phases. Phase one focused on getting a better understanding of the specific transportation needs of the target groups, and then phase two was developing a final report. And I won't go through all of this on this slide, but just to mention a couple of the things we did in our research. We conducted a survey of the volunteer driver programs of the VA's Volunteer Transportation Network and its major supporter, which is the Disabled American Veterans, or DAV. We got 99 responses to that survey, some very interesting and really heartfelt responses to that. We also did an online survey of the Department of Labor Employment Specialists who work with veterans. And to that survey, we got over 400 responses, very robust response, covering all 50 states as well as Puerto Rico. Again, some very interesting responses to that survey. So some of the key findings from our phase one research, there are roughly 23 million veterans, and their transportation needs vary by where they live, by the specific transportation resources available in their own communities, if they have their own transportation and can still independently drive, and significantly whether or not they're enrolled in the VA healthcare system. For older veterans, medical trips are generally considered to be the most critical, and especially trips for dialysis. The volunteer driver programs are a resource, but our survey found that half of them, 50% of those programs, are at capacity either daily or weekly. Veterans of our recent wars, healthcare trips are important, with many of the veterans suffering from PTSD, traumatic brain injuries, and also spinal cord injuries resulting from IEDs, improvised explosive devices. And then we found employment trips are quite important. Our survey of the Department of Labor specialists found that transportation is a real problem, and unfortunately most of those specialists have very little that they can offer in terms of helping the veterans. According to our survey, most frequently the specialists said they just refer the veteran to an organization that could help, like the local transit agency, or perhaps a local VSO, Veterans Service Organization, or a faith-based organization. Some of the specialists did indicate that they have gas cards that they can hand out, and these are useful only if the veteran has a car, motorcycle, truck, some sort of vehicle, and if that vehicle actually works. A few of the specialists indicated that they would actually drive the veteran themselves to a job interview, and two survey respondents told us, interestingly, that they provide bikes to veterans who don't have a car. Veterans with disabilities, their transportation needs vary by the type of disability they have and whether and where they're being treated. The volunteer driver programs are important, but most of those do not have any accessible vehicles, so their services really aren't an option if the veteran uses a wheelchair and can't transfer to a vehicle seat. Homeless veterans are often transit dependent. The numbers shown here on this slide are the numbers that we have in the report, but there's actually new, more recent data from 2014 that shows that the number of homeless veterans has actually fallen to just under 50,000, and that results from all the efforts of the Obama administration to end veterans' homelessness. It's also important to recognize that some of the mobility needs of veterans overlap with the needs that we see in the general public, and these can stem from, a variety of reasons: older age, frailty, disability, lower income, and so forth. But a distinguishing factor is whether or not the veteran is enrolled in the VA healthcare system, and the VA reports that this is about 38 to 40% of the veterans are actually enrolled in the VA medical system. Impacting their transportation problems is that the veterans of our recent wars disproportionately live in rural areas. The VA Office of Rural Health reports that veterans from rural areas make up almost 1/3 of the veterans enrolled in the VA healthcare system. And then impacting transportation is that the medical centers are located regionally, so a trip to get to one of those medical centers can be quite long distance. If public transit is available, it may require one or more transfers from one jurisdiction's transit system to another, something we know that's not always easy. And then in rural areas, there may be no public transit option at all, and this is, of course, where the volunteer driver programs become so important. But many of those are at capacity. About 75% of the volunteer driver programs responding to our survey said they don't have enough volunteers or vehicles for the demand that they're experiencing. Family members of veterans are also often their caregivers, and the literature reported that about 8 in 10 of these families help their veteran with transportation, and that they would like help with that so they don't always have to provide those trips themselves. For active duty military, their needs are generally different from those of veterans, and their needs vary by where they're based. Is that based in a large city, small city, a rural location? And their needs also vary by whether they live on the base or outside the gate in the community. It's only about 30% of service members actually live on a military base. We found through the research particular needs among junior enlisted ranks, particularly if they're married and have children. And it's those service members who are more likely to live off the base because they're lower in rank, and then being off base accentuates their transportation problems because they're outside the informal family support network that exists among the military community on base. We also found transportation needs for service members who are temporarily stationed at a different base than their home base for training purposes. This is typically training that goes on for several months, and typically they don't take their own vehicle. We spoke to the transit agency in Jacksonville, North Carolina. It's a large Marine base there, Camp Lejeune. They receive continuous groups of trainees, and the transit agency there operates express bus service just on weekends from the base into town, so these Marines can have some R&R. And interestingly, it's those routes that are the agency's most productive. So phase 2 is developing the report. The panel had 2 objectives for that report, which we followed. First was to provide a resource that would help communities improve transportation options for the target groups, and secondly, to build on the concepts of coordination and mobility management. We put a lot of thought into how the report would be structured and its layout. It follows a very organized process building on the framework of transportation coordination. It's very reader-friendly. There are lots of tips and tools, and each chapter begins with a graphic that you see here on this slide with a particular chapter highlighted that you're about to begin. So on this slide, it's Chapter 5. So a quick preview of the report. We chose Chapter 5 titled Planning, What Do We Do Now? The chapter has 6 steps. They walk the reader through a logical progression of how you can identify and document the transportation needs of veteran service members and families, and then how to identify and plan strategies and improvements to meet those needs. Then at the end of the chapter are the tools. This shows the various tools in Chapter 5. They include sample surveys, examples of GIS maps, as well as resources that already exist. For example, the United We Ride campaign has a number of good tools that can be used, and we provide links to those resources. So this is just a sample of one of the tools at the end of Chapter 5. It's a survey that's basically ready to be used by a community to help identify needs. And then a second sample tool. This is shows how the data on veterans can be displayed, which actually makes things more real to the community when you're discussing needs. We explain where on the census website you can find the data on veterans, and then how to extract that data. So for example, in Heather's work in Southern California, which included vast areas of, outside of the city of Los Angeles, including, huge parts of the Mojave Desert, Heather's team found from this type of GIS analysis that there was a high density of veterans living among a small number of persons in the desert. So based on this analysis, their work could then focus on solutions to meet those very long rural trip needs. So that actually is my segue to Heather.
As Buffy's indicated, I'm going to talk about those unique mobility challenges that Buffy's already highlighted, and talk about these in the context of some rural settings where to some extent there are certainly parallels to the urban environment, but because the rural environment has fewer factors, it may be easier to see the issues. Buffy's already highlighted the kinds of trip needs, the problems of connectivity over these long distances, and we will talk a bit about the importance of integrating veteran transportation planning into the traditional transit planning processes that exist, how we can break down these information silos between service sectors and systems. So I'll be talking about 3 different rural environments first. In terms of trip needs, as Buffy's already indicated, we have long-distance trips traveling from those 152 VA medical centers. Individuals traveling to their benefit offices, which are usually at the county level, can frequently be at some distance from the individual's home. To the community-based outpatient clinics, there are now about 800 of these around the country, and again can be at some distance from the individual. So with medical trips, we hear these as the trip that has the most frequent difficulty finding a good solution. And there's a related problem of the timing of trips to make these long-distance connections. You see here on the slide on the right, the individual driver of a VTS program that leaves from Sonora in Tuolumne County to head down into the Central Valley of California. He leaves before 5 a.m. every morning, well before the public transit service is operational. So that is a challenge. We heard as well about disproportionate numbers of veterans using mobility devices. Whether there are actually more veterans in wheelchairs than there have been previously, we can't know, but it is clear that finding ways to meet these veterans' trip needs is a challenge. The DAV has in its charter that it will only serve ambulatory veterans in order to make that easier, I presume, for its volunteers, but that means that the DAV system is, of course, not a resource. We heard as well about aging spouses, and this came back from the DAV survey. Some of the DAVs cannot carry unaccompanied spouses. So in those instances where the veteran becomes hospitalized, when he visits the VA and his health is compromised sufficiently that they keep him, there's then the challenge of how to get the spouse home. We also heard in a couple of instances about the difficulty of helping elderly spouses get to national cemeteries that are usually some distance from their home community, essentially an escort trip, what we would call door-to-door or door-through-door. So these are some of the sort of challenges. I'm going to turn now to the experience of Trinity Transit, and one of the problems was that almost every trip was a long-distance trip with connections to other services in order to complete that trip. There are community-based outpatient clinics both in Reading and in the Arcata-Eureka area, so Trinity Transit's challenge was to convey to veterans and their family members how to make connections to those services. What you're seeing on the screen here is the interactive website that was developed as part of another project, but its intent was to show clearly these connections and how to make long-distance trips using Trinity Transit. So we see in the northwestern corner the connections from the Tribal Transit KTNet Hoopa tribal members, as well as connecting in Willow Creek to the Arcata-Eureka Mad River system. On the eastern side, as I indicated, the service goes down into Reading, and riders can connect there onto Reading Transit. So this interactive system helps communicate those connections. There was also developed a travel training piece on the website, one travel training element for consumers, and the second one that has been used by and is intended for community service agency people who want to train their consumers in how to make trips. So these were among the information tools that are important in helping connections in Trinity County. But it didn't solve all the problems. As you see here on the right, this is the announcement of the VTS transportation system that Buffy made reference to, leaving twice monthly, the first and third Tuesdays of the month, to head down into Reading from the county seat, Weaverville. The problem veterans identified for us was this very narrow window from 8:30 a.m. going down, arriving in Reading, and then returning at 10:45. That's a fairly small amount of time if you have any kind of medical complexity or multiple appointments. So that's where the information piece became important to help veterans understand how they could go down on the VTS system, come back on Trinity Transit. A second issue related to those numbers of persons in wheelchairs, and here a 5310 provider, the Southern Trinity County Health Services Program, is playing an important role. This 5310 vehicle travels at some distance in the south part of the county to help make connections for veterans, connecting in Hayfork to the Trinity Transit system and from there to other parts of the network. So this is just one example of the role of different players in making connections for veterans and getting their mobility needs met. Southern Trinity Health Services, a 5310 provider, the VTS program, Trinity Transit, Trinity County Veteran Services are directly operated programs. There's also an important mileage reimbursement opportunity in Trinity County to help meet other needs. and public transit, of course, playing the primary role in the overall network. Shifting now to a different county, Tuolumne County, that sits in the Sierra Nevada mountains on the eastern side of the Central Valley and is the home of Yosemite National Park. Here we had that very early morning trip coming down from the VTS program that was difficult for the most frail among the veterans. That large 40-foot bus is uncomfortable, particularly if it's traversing mountainous roads that curve and twist. And so while that service existed, it wasn't always the solution for some of the most frail. The existing information tools didn't help with connections, and there was also a problem around parking of that big bus. So in terms of Tuolumne County Solutions, there are two volunteer-based programs that are meeting important gap-filling needs. The trip mileage reimbursement program, with a model that's based here in Riverside County, provides mileage reimbursement to the rider who finds his or her own driver to make that trip. But they now have a way of asking a neighbor or a friend for help and assistance with the trip. It also provides an escort that's useful for some of these most frail individuals. The second volunteer program is a more traditional volunteer driver program operated by Groveland Wheels. It sits at the edge of Yosemite Valley and is a small, fairly homogeneous community, but a lot of aging in place. And as Buffy has indicated, many veterans are in rural settings and have increasing trip-making need as they age. So the Groveland Wheels program was highlighted in the Guidebook because they're using a very cool Google Drive program to enable the volunteer trip coordinator to communicate with his volunteer drivers. These drivers volunteer 1 or 2 days a week, 1 or 2 days a month. And using Google Drive, he can build a schedule for trip making for these individuals. And it's been very successful. The drivers can then report back on trips provided and mileage so that the system can get the information it needs. Finally, in relation to parking that vehicle that we saw earlier, there was the support of 2 retail organizations, Lowe's and Starbucks, at using their parking lot for the vehicle to be parked overnight. The DAV vehicles did speak about issues of parking and security for that, so that finding solutions for that is a simple, low-hanging fruit way of supporting the DAV network. Moving now to how we integrate solutions into regional planning, because obviously the kinds of strategies we're talking about need to become institutionalized over time in order to work effectively with time. So I'm moving now to Imperial County, the lower corner of California, sitting there on the edge of the border with Mexico. To the south, San Diego County to the west, and the Colorado River and the state of Arizona to the east. So here, long-distance trip-making was significant because in some cases it involved 2 states. Although there is VA health service in Yuma, Arizona, there were specialty clinic appointments that individuals had to traverse all the way to San Diego in order to meet their needs. So by-state and regional planning was very important in ensuring these trips were made. Similarly, the Title VI program offered some tools to the Transportation Authority in ensuring that it's reaching its bilingual and monolingual population, those with limited English proficiency. In Imperial County, 32% of the residents speak English with some difficulty, and what we learned was that there are U.S. military veterans, numbers we can't count, who live in Mexico, in Mexicali, because of the lower cost of housing or because of a strong family support network. So in some cases, we're communicating with the family members who don't necessarily speak English well, but we want them to be aware of the transportation services that exist. And then finally, there's coordination with the 5310 program, some opportunities developing, which I'll make just a comment about in a moment. Medical system providing some funding support for that. Again, this continuing theme of working out of the information silos, working to break those down and ensure that people who need to know about what exists are aware. So turning to that eastern edge of Imperial County, the Chechen tribe straddles both sides of the Colorado River. They're in California and in Arizona. You see here the Chechen tribe's 5310 vehicle that operates out of the senior center helps to bring some tribal members into services. There's a very strong tradition of military service amongst this tribe, so there are large numbers of veterans of a variety of ages. And the connection there was to help these veterans get into Arizona using the YCAT service in the adjoining town, Winter Haven, but importantly, back into Imperial County with connections onto San Diego for some of those specialty appointments that I referred to. So what happened here was that the coordinated plan process and its update helped identify the needs of these very rural veterans, but then by working tightly with the short-range transit plan helps to ensure that the connection, it's the turquoise line from YCAT service area into the Imperial County Transportation Commission service area, that there's continuing funding support for that connection as something very critical to sustain and enhance. Finally, the importance again of information sharing. There were members of the Indian Health Services who were not aware of the YCAT service. The senior center members were not aware of some enhancements to that YCAT turquoise lines terminus in Imperial County. So the continuing attention to how we share information. And just in closing with regard to Imperial County, I've identified the tools of the short-range transit plan, integrating that with some outreach of the coordinated planning update process, using the 5310 grant process to get vehicles and now operating funds to help fill some of these gaps, and using the tools of the Title VI outreach process to help bring in limited English proficient populations, sometimes family members of veterans. Just in closing, one of the outcomes here in Imperial County is a planned mobility summit at which for the first time they will be inviting the DAV contacts that we made and the community-based outpatient clinic. This DAV in Imperial County was one of those Buffy referred to as being at capacity. It didn't know how to handle more trips than it was providing. And similarly, the community-based outpatient clinic was reporting large numbers of veterans in wheelchairs. It didn't know how to serve them. The very distressing piece of information we learned was that neither of these service systems was aware of MedExpress. MedExpress is funded by the Imperial County Transportation Commission and travels daily between Imperial County and San Diego medical facilities. So again, the importance of information sharing and ensuring over time that critical information is in the hands of those who need it. So I'm going to shift gears here now and talk about the last portion of our presentation for you today, and that is how to use the guidebook to measure impact, to be able to identify what differences we are making, and to be able to report on those meaningfully. And I'm going to talk now about performance measurement in a large urbanized area, and talking very specifically about the VTCLI Inland Southern California project. But as Buffy indicated, the guidebook is very structured in order to help you dive into it in the place and around the topics of concern to you. It's step-focused, so here in relation to Chapter 10, Evaluation, how are we doing? We identify the steps of restating your objectives, defining your measurements, establishing evaluation reporting, and reporting your outcomes. So now moving to the Southern California counties that are the focus of this VTCLI Round 1 grant. San Bernardino County and Riverside County together comprise 27,000 square miles. As Buffy indicated, it's a large expanse. There are 3 large urbanized areas that sit at the edge of LA County, but many rural, isolated areas. And we have learned with the demographic analysis that there are significant numbers of veterans in some of these counties. There are 3 military installations. There's 1 regional VA medical center at Loma Linda, 7 community-based outpatient clinics, and there are 3 vet center residential facilities serving this 4.2 million population and almost 250,000 veterans. So the kinds of mobility issues this presents mirror those we've already been talking about, related to trips, long-distance trip making, related to information about what does exist, and related to connections. In thinking about performance measurement for the VTCLI Inland Southern California project, 3 general goals have been identified following the steps of the guidebook. The first goal is to focus on the individual. The second goal is to improve information. And the third goal is to promote affordability. These borrow the structure of the Texas A&M Mobility Management contributions to the literature about how we importantly can measure projects of this sort. So looking at Goal 1, performance measurement in terms of focus on the individual. Through the advocacy efforts of the VetLink project and increased awareness of the transit operators in the region, we do now have new links to important destination and enhanced services. An important one is the BV link coming out of Barstow down into the San Bernardino Valley, a trip of more than 100 miles. It was initially established to connect Fort Irwin, the military installation 30 miles above Barstow. That service didn't get sufficient ridership, so it was translated into the Fort Irwin Flyer, a couple-day-a-week service. But importantly, it introduced both people at the fort and in the community. We have a lot of veterans living in Barstow, not uncommon that you have large numbers of veterans near a military installation. They now have a connection down to the San Bernardino Valley and the regional services there that didn't previously exist through the BV link, which continues with growing ridership. In the urbanized area, Riverside Transit Agency has improved its service to March Air Force Base, where there is a U.S. Vets housing facility working with these veterans, many of whom are re-entering the job market and often coming in at entry-level jobs, retail jobs, and second shift, sometimes third shift. So the service that was in place there was not useful to those kinds of trip-making. Frequency of service, span of service, all were addressed and have been improved as RTA continues to watch utilization there. Important was a new link from the Palm Springs area into Riverside to regional transit services. That has about an 80-mile connection on the new Route 220, and importantly, it enables connections another 30 to 40 miles up from the 29 Palms Marine Corps base. Just anecdotally, we had the case of an Australian individual who was part of an Australian group training at the Marine Corps base, who wanted to get his father, connect with his father at LAX airport about 200 miles from the base, and was looking at taking a taxi to meet his father at the plane. He was unaware of how to make connections, and he didn't have to make that taxi trip, thankfully. So also in terms of focusing on the individual, another program that's in place is this new veteran travel training program that Riverside Transit Agency has instituted, which works one-on-one with veterans who are in some cases have holed up and retreated to their homes or apartments, unable to go out. And this program has made one-on-one very good intervention with those individuals. So what can we measure about initiatives such as this? How do we report back on impact? Well, what you see here on the screen is the traditional on-off count boardings and alightings at stops in the vicinity of the Loma Linda VA Medical Center. And we have two providers on red and green, 2 years worth of data, and Riverside Transit Agency coming in from the neighboring county, smaller boardings and alightings in the purple and blue. Also, there are demand response, both repair transit services from each county arriving at the VA Medical Center. This particular map and data printed on the back of it that show the actual numbers of average daily boardings and alightings was used as a tool with a VA steering committee group and the VetLink coordinators to help communicate to VA staff your veterans are using the facilities. Here's where the stops are. This is what it's looking like on a daily basis. How can we promote and grow this? Onboard surveys, of course, are another way of getting more individualized information about whether or not these are new trips and other characteristics. Secondly, in relation to the travel training program, there are a number of variables that can be counted: persons trained, training hours, trips provided. The Riverside Transit Agency has brought back, as Buffy indicated, compelling stories. This one particular individual was travel trained to get from Riverside County up into the Loma Linda VA Medical Center. Began with an initial appointment that then extended to a number of other appointments, and now he's beginning to job hunt because of the travel training. Riverside Transit Agency is collecting data. You see here on the bottom of the screen, not the veteran travel training program because that's still new and data is developing, but it's disability travel training program. These are trips taken monthly, and the red line is the unique number of persons trained who are traveling monthly. And because the policy decision of the transit agency has been to provide free passes to those who are travel trained, that pass is coded. It enables collection of data at the fare box on each bus, and so we can report what the continuing impact of the travel training is. Moving to Goal 2, Improving information, clearly a central part of the VTCLI initiative, very much at the core of it. And the tools that the VetLink program has to work with are its 2 mobility managers, 1 in each county, the VetLink One Call component through the 211 system, and the One Click component. So it's both telephone and web-based. It focuses importantly on several different audiences, both the individual veterans and their family members, as well as agency staff, and these stretch from the VA personnel to those at military installations and those community-based outpatient clinics who may not be aware of resources that exist, as well as other community-based organizations working with veteran populations. The program's working with the existing network of public transit and specialized transportation programs. As you can imagine, it only incompletely addresses all the need within these vast counties, but for the first time, this program is able to encompass all of those services. So looking then at what we can measure of these initiatives, working with the 2 mobility managers, the One Call through the 211 organizations in each county, and the One Click. The VetLink to Go trip planner, which I think you can see on the lower part of the screen, that web badge enables those visiting the websites of other participants to get directly through to the trip planner. And I'm going to digress just a moment here about the brand new 211vetlink.org trip planner. This just went live in January. We're very excited about what it is enabling in terms of addressing these key information challenges that in setting after setting present. So you're seeing here the opening screen of the VetLink to Go trip planner, where the individual is invited to provide information about whether their trip is round trip or not, what mode they'll travel, trip purposes. Sometimes certain specialized transportation will only serve particular purposes, where they're leaving from, going to, and there's some information about the time of day as well that you can't see. This goes through several different steps and arrives at an array of options which present here on this screen. And what you see, this particular trip plan is presenting options for an individual living in Norco and traveling to the VA Medical Center in Loma Linda, a distance of about 25 miles and across 2 counties and several service areas. There are 4 fixed route options. The one with just a single transfer requires the individual to start walking some distance very early in the morning, but there are several other choices with shorter walks that do require 2 transfers and get the individual there by that 8:30 or so time frame that they're shooting for. Very importantly, and I think what I'm most excited about, is that this trip discovery tool enables providing information about the specialized transportation services, something that Google Transit can't do. We can get the first part of this screen through Google Transit, but we can't as yet get specialized transportation resources except through tools like this one that brings back, for this particular trip, there's the DTS special mode travel. Also the VAV transportation would serve an individual traveling from Norco into Loma Linda, and there's the Dial-A-Ride program that is making inter-county connections. You see on the far right there are question marks where the individual would click through in order to identify eligibility information where that has relevance. And on the far left you see cost information. This was identified as very important to us by both consumers, veterans, and by community agency personnel working with them. How much is it going to cost me to get over and then also to return home? And this trip plan is showing both the travel to the VA Medical Center and the trip options to get home. So we are, as I indicate, quite excited about what this is enabling in terms of trip discovery, but also helping us identify more clearly gaps where you can't come up with a trip plan that can reasonably serve a given trip. So what can we measure? The mobility managers, again, using some of that Texas A&M strategies for identifying a variety of contacts and other means of calibrating what they are doing and reporting its impact. They're collecting information about their daily travels across these broad counties. The One Call, One Click elements of the program, the telephone system collects a significant amount of data. We've learned that 52% of the callers are transit dependent and need some assistance in getting to where they need to go. And the One Click program clearly is bringing back information about trip planner hits to begin with. trip plans as these develop over time and the origins and destinations that these are attempting to serve, we hope will give very meaningful, robust information to the transit programs as they continue to address mobility needs of veterans. And finally, goal 3, affordability. This was very important to our mobility managers who were keenly aware of the fact that the newly released veteran often didn't have a job, was without employment for some piece of time, and even upon securing a job, sometimes that was at a lower income level than they had perhaps been used to, needing to have affordability at the front and center of their transportation. So since the work of the mobility managers over now almost 2 years, the transit agencies in this region have moved to reduced fare for veterans and free fare for active military duty. The reduced fare for veterans is half price and mirrors the elderly and disabled fare structures. What can we measure? Here we're seeing the reduced fare information that comes back through Riverside Transit Agency's Veteran ID card. Those veterans applying for reduced fare get an ID card that's enabling counting of trips by type. You see that we're seeing the cash fare of active military duty, as well as the fare utilization on the 30-day pass, the regular day pass, and other cash. So what we can't see here is new trips, but I can report anecdotally that there appears to be a strong increase in the number of veterans using this fare medium, and we hope through onboard surveys to better capture how many of those trips are new. So just in closing, as I pass it back to Buffy, I would just say that it's very important to measure all that we can, but then equally important to report it to other audiences, to pat yourself on the back, give yourself credit for what you're doing, and communicate that to others so that we know we're collectively making a difference in the mobility of veterans and their family members.
So Heather, thanks. And clearly, Heather has indicated how important performance measurement is. Sometimes it doesn't get the attention that it deserves, but of course, first you need to have transportation improvements in place so that there are things to evaluate. So that brings us back to the report as a wrap-up. This report, 164, is essentially a guidebook. It presents an organized, stepwise process that a community can use to improve transportation for the target groups. Much of the guidance does follow the process for transportation coordination and mobility management, and of course those are processes with which in the industry we've become perhaps too familiar with. But what we tried to do in this report is bring out what's different about the transportation issues impacting veterans in particular. And so I'd also like to note in closing that the guidebook does not necessarily have to be followed step by step. I mean, while we certainly like our graphic that implies that stepwise progression, there is information that can be useful in just a particular chapter. For example, Chapter 8, titled Business Practices, has some very useful information on topics relating to actual transportation operations, such as different types of vehicles, the differences between lifts versus ramps, and some advice for operating onto or trying to operate onto a military base. The author of that chapter, a member of our research team, is an Army veteran, so he brought that perspective and experience to our project. So with that, we are done. And for those of our listeners who are now working with veterans or who may be veterans, thank you for all your efforts.